Hi, everyone. Welcome back to Easy Living's Ask a Professional. My name is Ryan Abramski. I'm the Business Development Director. We're a local home care and care management agency serving the Tampa Bay area for now over 22 years. As many of you are aware, we're focusing on different awarenesses for each month. And for the month of April, we are talking about Parkinson's disease and Parkinson's disease awareness. So we're lucky enough today to have Dr. Herrema, and she is a local neurologist for Central Neurology in St. Petersburg. Thank you so much for joining us today, Dr. Heather. Appreciate your time today.
Hi, Ryan. Thanks for having me on. I'm very passionate about speaking on Parkinson's, so really appreciate the opportunity to be here.
Absolutely, absolutely. So tell us a little about yourself and what you focus on and what you specialize in regards to neurology and especially with the Parkinson's disease type patients.
Okay, great. I'm a neurologist that has been practicing in the area for about 5 years now. I completed my neurology residency up in Michigan, and then following my 4 years of neurology, I chose to do an extra year of fellowship in what we call movement disorders, which does cover lots of different movement disorders, but a huge emphasis of that was Parkinson's disease. And that's kind of where I put a lot of my energy, and the majority of my patients in my practice fall into that category.
Great. So when you talk about movement disorder and what you focus on as far as a specialty, like what exactly does like a movement disorder specialist kind of do with their patients?
Yeah, so I mean, just like another physician, we kind of bring you in, we take you, your history, examine you, and then come up with a diagnosis and then help manage it. I always tell my patients, I think the benefit of seeing a movement disorder specialist if you have Parkinson's is that it really is a complex disease. It's not just the motor symptoms that many people think about, but goes into things like anxiety, depression, and memory problems, constipation, bladder issues. And so really seeing a specialist who understands all of those dynamics, I think allows a patient to have better care.
Absolutely. And I saw a great image online when I was looking up information about Parkinson's disease, and it was like an iceberg, and the tip of the iceberg was tremors, and that's kind of what everyone associates Parkinson's disease with. But below the water is exactly all the other symptoms and things that people deal with, just like as you're speaking, that people might not realize that they're going through when dealing with that disease.
Yeah, absolutely. I mean, Parkinson's used to be called the shaking palsy, but now we know up to a third of patients may never have a tremor. So although tremor is common, it's often the first sign that a person, goes to see a neurologist. It's much more complex than that.
Absolutely. So kind of transitioning from that, what are some things that people can look for maybe to early identify that they might be dealing with Parkinson's disease and maybe getting some warning signs or symptoms that they might be dealing with it?
So there's a mnemonic called TRAP that we use in neurology to describe Parkinson's. So the main motor symptoms that you are tremor for the T. The R is rigidity or stiffness. So just feeling like all your joints are, a little bit stiffer, not moving as well. And then the A is for akinesia, which is loss of movement or slowness of movement. So if, all of a sudden you just feel like you've slowed down, and, like you're running on an empty tank, if you will, that may be a sign something's going on. And then the P stands for postural instability, so imbalance, which usually is a later symptom, but some people can present with.
Okay.
So that, the classic gait in Parkinson's is sort of this slow little shuffling gait, the forward flex posture. So those are some symptoms that people may present with.
And if someone is feeling like maybe they're exhibiting some of these signs or symptoms, like what is the best first step for them to do?
Yeah, I mean, I would definitely see your your primary care doctor, who would probably at that point refer you to your neurologist. There is not a test that 100% says you have true Parkinson's disease, but definitely history and exam are a huge part of that. And then there are some studies that can be done to sort of help guide that diagnosis, one of them being called a DAT scan. And then, if they can try medications and you respond to the medications that we typically use in Parkinson's disease, that also kind of confirms the diagnosis.
Sure. And, besides medications, is there anything else that you guys do with the patients that, have confirmed Parkinson's disease to try to help them, live a more comfortable life when dealing with this disease?
Yeah, absolutely. So, I mean, at the moment, there's not a cure for Parkinson's disease. And although we have medications, they all kind of act as a band-aid to alleviate symptoms. Although they definitely improve quality of life, they're not going to change sort of the course of the disease. On the other hand, we have seen that exercise is really, really important in Parkinson's patients. So that's definitely something I really push for my patients. We still don't know the exact form of exercise that is the best, but there are some really great Parkinson's specific exercise programs in the area. There's like a rock steady boxing for patients, delay the disease. So exercise programs that really focus on, where their issues are can be really helpful, and also provide sort of some social support. Since COVID, they've sort of lost a lot of these support groups, which has been hard, but taking care of both, the patient as well as their caregiver emotionally is really an important part of managing the disease as well.
Yes, absolutely. And that's really great information. And they always say exercise is important, but obviously it seems it's definitely a way to really improve that in quality of life for Parkinson's disease patients.
There's a lot of evidence that it may actually slow the disease down. So
wow. Okay.
Really important.
Yeah, that's great to hear. And, I think anything to really help those individuals deal with a better quality of life is always beneficial. So,
absolutely.
Well, I really appreciate the time today, and our audience appreciates the information and time. It's always good to talk about Parkinson's disease and how much it affects so many different families and individuals out there. And as many people know, a lot of, it really can affect anyone. We know a lot of the famous people, Michael J. Fox, Muhammad Ali. So it just goes to show you it really can affect anyone out there. So
absolutely.
Dr. Herrema, I really appreciate the time today, and thank you so much for joining us. And we'll put your contact information down for your office, which is Central Neurology in St. Petersburg, Florida. And if any of you have any questions or comments, please put them in our comment section below. Send us a message directly on Facebook, or you can always fill out our contact us form on EasyLiving's website. And if you have any questions or want to get a hold of Dr. Herrema or her office, we'll be sure to put you in touch with them.
Great. Thank you so much for having me.
Absolutely. Thank you so much for joining us.
Bye-bye.